Good afternoon, everyone. For anyone who doesn't know me, my name is Sarah and I'm the National Strategy Manager at Volunteering Australia. I'm thrilled to be with you and presenting this webinar today. Before we go on, I'd like to acknowledge the traditional custodians of the lands on which we meet today. For me here in Melbourne, or Naarm, it's the Wurundjeri and Bunurong peoples of the Kulin Nation. I'd like to pay my respects to elders past and present and acknowledge sovereignty was never ceded. You may wish to acknowledge the traditional custodians from where you are joining us in the chat today. A little housekeeping as we start off. Today we have some wonderful speakers, Ruth and Nathan. You'll be invited to ask questions of them at the end of the presentation. So given this webinar is part of our ongoing series of webinars on implementing the national strategy, as I said, we're incredibly honoured to have our guests from Inclusion Melbourne with us today to talk about their approach to inclusive volunteering and how to deepen our understanding of what inclusion truly means for people with intellectual disability. Before we get into that, however, though, I'd like to very briefly introduce everyone to the national strategy, particularly for anyone who may be joining us for a webinar for the first time. So what is the national strategy? The national strategy is a 10-year blueprint and national strategic framework. It provides a clear and compelling case for change to achieve a better future for volunteering, underpinned by robust data and evidence. Its vision is to make volunteering the heart of Australian communities. The national strategy was released in early 2023 after a comprehensive consultation process with representatives from all different parts of the volunteering ecosystem. Thousands of stakeholders participated in online consultations, interviews, participatory design workshops, working groups, surveys, and a bespoke research project to build the national strategy for volunteering. The culmination of this process identified a unifying vision, 3 focus areas and aims, and 11 strategic objectives. In August 2024, Volunteering Australia released the Action Plan 2024 to 2027, which highlighted a suite of 22 actions that have been committed to by the volunteering ecosystem to drive us towards achieving the vision in the strategy. The actions include commitments from 5 federal government departments and agencies, 7 state and territory volunteering peak bodies, the National Strategy for Volunteering Research Working Group, Volunteering Australia, and Justice Connect. These actions are a mix of new and aligned actions that are designed to build momentum towards the strategy's goals over the next 3 years. To date, there's been a lot of work to progress the actions in the Action Plan 2024 to 2027. This includes the national standards being refreshed and aligned with the national strategy, a youth volunteering campaign run by DSS, webinars such as this one facilitated by Volunteering Australia, sharing inclusive practice and research, community-led and informal volunteering approaches, and we've also launched an employee volunteering community of practice. There's likely a lot of activity that's going on already to implement the national strategy that we aren't even aware of. So as National Strategy Manager, I'm really keen to highlight some success stories across the ecosystem. I've put the contact information on the slide there. So if you want to share your story of implementing the national strategy, please get in touch with us. So now to zoom back out a little bit to the context of today's webinar, which is inclusive volunteering, focused particularly on engaging with volunteers living with an intellectual disability. Inclusive volunteering is a core part of the national strategy for volunteering, stemming from Focus Area 1, specifically Strategic Objective 1.2, to make volunteering inclusive and accessible. As per the quote on screen, the strategy states that participating in volunteering should be inclusive and accessible for everyone. Volunteering should be an activity that people can engage in across their lifespan, which provides meaning and purpose. Participating in volunteering should be an easy choice where everyone feels welcome to come as they are and contribute their time, skills, and passion to activities and causes they care about. Access should not be mistaken for ability, and volunteering should take place in environments where people feel culturally and psychologically safe and included. Considering many of the barriers individuals face are structurally built into our society, ensuring volunteering is truly inclusive and interrogating our practice is an ongoing challenge. The national strategy document itself goes into good detail about different barriers faced by different groups of volunteers. In today's webinar, we're obviously going to deep dive and focus specifically on people with disability, particularly intellectual disability. Our speakers will go into this a lot more detail, but Across the strategy, consultation and research, people with disability identified stigma, unconscious bias, and lack of understanding as the greatest barrier faced to inclusion. This includes the prevalence of ageism, where people with disability are seen as less capable, less able to contribute, and not as valued as much as those without disability. Resoundingly, those whose inclusion needs are not met continue to report that they're systematically disabled by society, reducing their options for participating or preventing them from participating at all. And there's often really little consideration of people with disability as co-creators, co-owners, and co-deliverers in volunteering. And so on that note, I'm going to pass on and introduce our guest speakers who grapple with these issues and structures day to day throughout their work at Inclusion Melbourne. First, I'm going to introduce Nathan Despott, is the Head of Policy Research and Advocacy at Inclusion Melbourne, where he leads the Inclusion Design Lab's work to strengthen practice and develop practical, evidence-informed resources that strengthen inclusion, citizenship and self-determination for people with intellectual disability. In 2023, he was named Outstanding Leader of the Year at the National Disability Awards. And Ruth Morgan. Ruth has worked in the volunteer engagement sector since 2010, with experience across both the not-for-profit and local government sectors. Ruth has extensive experience in volunteer strategy, operational planning, training of volunteers and volunteer managers. So welcome to you both. I'm going to hand over to Ruth shortly. She'll introduce Inclusion Melbourne, then hand over to Nathan, who'll go over some of the frameworks related to inclusion, citizenship and self-determination for people with intellectual disability. And Ruth will then come back in at the end to talk about practical ways in which volunteer programs can be more inclusive. So Ruth, I'll get you to take control and thank you.
Thank you, Sarah, and thank you to the team at Volunteering Australia. It's great to be here. And like Sarah, I'm coming to you from the lands of the Wurundjeri and Bunurong peoples of the Kulin Nation today. And I'm here with my colleague Nathan, who, as Sarah said, is Inclusion Melbourne's Head of Policy, Research and Advocacy. So I'm just going to give you a little overview of Inclusion Melbourne. So at Inclusion Melbourne, I'm the team leader of community support, and we run and manage Inclusion Melbourne's volunteer programs, which includes the Leisure Buddy program, which is our signature volunteer program where we match volunteers with people with intellectual disabilities to develop a genuine friendship. So it's a one-on-one experience. And we are volunteer matching specialists. We have a few other programs as well. So at Inclusion Melbourne itself, we've been around for 78 years. And in that time, we've worked in the field of intellectual disability. And we're one of the longest standing organisations in the field. So Inclusion Melbourne, we know our identity quite well. So on this slide, I outline who we are, but also who we aren't. So we are a disability support organisation working with people to build connected lives in ordinary community settings, such as the Leisure Buddy program. We are an NDIS registered provider, an RTO, and we work with, we're a systemic advocacy organisation rather than a community-based or congregated model organised mainly through disability-specific settings. We are an organisation that treats friendship, reducing isolation and building natural relationships as part of our practice model, rather than an activity-based model where participation mainly means outings, groups or scheduled activities. We're an organisation that challenges low expectations about people with intellectual and cognitive disability, and don't work in a model that treats limited experience, confidence or independence as fixed. We are an NDIS provider with responsibilities for planning, safeguarding, records, reporting and quality. And the Leisure Buddy program, which I mentioned, works within those practices. And we're so we work within a regulated environment rather than a general community, social or volunteer program outside the regulated disability support systems. So I'm just going to our next slide, just one more slide before I hand over to Nathan. And this is just introducing Inclusion Melbourne through an inclusion lens, given the nature of today's webinar. So our aim is to create structures across all areas of life, including volunteering, that enable people to exercise full citizenship, and such as participating, contributing and belonging without barriers and without being treated as objects of charity or people who must be fixed or prepared to fit the norm. And it's possible that you see some of what you do within that same framework within your own organisation or volunteer programs. And I just thought I would just very briefly, I thought that this was a great learning, which I had last year. I went to a cultural awareness training session, and I think it fits well within the discussion today. And I wanted to bring it, I just wanted to put it in because it was such a great learning for me. And I just, yeah, so I'll read it out for you. If you don't notice an organization's culture, or you could be walking around your own neighborhood and you don't notice culture, it may be because it reflects your own. Dominant culture often remains invisible to those whose identities, ways of communicating and participation are already treated as the norm. So I thought that was quite fitting for today. And now I'll hand over to Nathan, who will introduce more about the detail of our practice. Thank you.
Thanks, Ruth. So yeah, it's such a wonderful opportunity and a privilege to be able to be with you all today here. Following on from Ruth's introduction, I wanted to run through, I guess, some elements of our practice model that we have at Inclusion Melbourne, or rather our practice framework, which is the framework we have where we pull together all the different evidence-based models that we use as a support organisation. And without going into a deep dive about what we mean by that term practice or clinical and practice framework or practice governance, all these terms from our sector, I wanted to run through some core ideas around defining intellectual and cognitive disability, and also talk about some of the interesting but really quite pivotal considerations around the relationship between people with intellectual and cognitive disability and volunteering from many different angles and directions. I should also note that some of the framing that I'll be outlining today is frequently built up with generalizations, and or perhaps sometimes I'll be describing 90% of the people we sort of work with, which is still important, and there might be some exceptions to some of the different framings that I'm using, and that's fine as well. But the reason that I'm wanting to run through some of these things is because there's a bit of a paradigm shift needed in the way that we, first of all, talk about people with intellectual and cognitive disability, and also how we include people with intellectual and cognitive disability in this framing. So a lot of the content that I'm sharing today comes from work we've done over many years with people with intellectual and cognitive disability. And indeed, if we were running a slightly longer workshop, and if we were doing some activities and exercises and perhaps covering some of the conceptual background a bit less, then I'd usually be co-presenting at a session like this with one of the people with intellectual disability who we run projects with. But obviously we're not doing that today. But I do want to acknowledge that a lot of what I'm sharing has been pulled together through partnerships with self-advocates, self-advocacy groups, researchers, co-researchers with disability as well, and that kind of thing. So first of all, this term intellectual disability that we use it in a sense where it's not necessarily in line with the sort of medical model of disability that many would be familiar with, or the usual connotations of intellectual disability in terms of a diagnosis or IQ. We don't really think about intellectual disability in that way. We might use the term developmental disability, and sometimes we use the term cognitive disability to describe a broader group. And that term cognitive disability in advocacy research and policy usually is a bit of an umbrella term for people with intellectual disability, some people with acquired brain injury, some autistic or neurodivergent people, but not necessarily all, and some people who have complex mental health experiences as well, where there's an impact on cognition. But one of the things that I guess, unfortunately, binds these groups of people together are some of these experiences I'll run through now on the screen, and I'll read through them. So people with cognitive disability often have shared experiences of exclusion and gatekeeping. So they're more likely to live under guardianship and have experiences that reinforce dependence or limit self-determination. They're often reliant on support to access community life, meaning that spontaneity or risky activities or activities viewed as risky by others, and also living a flexible lifestyle. It's harder to achieve these things, often if you're relying on various forms of external support. Often this group of people is viewed as excluded from experiences of full citizenship, which I'll discuss more in a moment, including things like voting, parenting, living a full experience of sexuality. We do a lot of work in the area of LGBTIQA+ inclusion with people with intellectual disability, and so we see a lot of exclusion there. And also other areas of adult life that are considered normative for most people in the general population. And there are reams and reams of citations that I don't have time to share with you now behind each of those items I've mentioned. Another commonality is that people with cognitive or intellectual disability are more likely to be assessed by health workers or health professionals in ad hoc ways in relation to their consent or cooperation or ability to cooperate in treatment or in a health appointment. And often their capacity to consent or engage in a health appointment is judged sort of in the moment, rather than using supported decision-making, which is an important support model. So we often see people with intellectual disability referred on to specialist treatment centres rather than being treated in their, say, local medical clinic or local dental clinic or that kind of thing. And I won't go into that now, but that constant sort of pattern of being referred to disability-specific services in a non-local setting has some massive impacts that are actually more closely related to significant rates of preventable early death than you might realise. Often people in this group have their expressions of distress or fear or trauma misread and perhaps labelled as being behaviour or behaviours of concern, or being viewed as some sort of evidence of a disorder, when often what's needed is communication and support. The people have not had an opportunity to learn how to communicate some of these things. And often, quite simply, people with cognitive impairment are judged or they have their capacity judged based on their verbal fluency. And silence or a gap in communication support is viewed as a person not having capacity. So what we say then is that while biology plays a role in these experiences of intellectual and cognitive disability, often what is actually at play is low assumptions, a lack of access and communication support, restrictions on learning and identity development, and fewer genuine opportunities for capacity building. So I know this is a very, we might say, meaty slide with a lot of information, but this is, I guess, part of the foundation that we're coming from. And I think a lot of you would agree with this sort of framing, I guess. And indeed, most of the support that we deliver with people with intellectual and cognitive disability and most of our project work around practice is really actually about dealing with and navigating the effects of these things, not necessarily, I don't know, neurological considerations. Yeah. Another term that we often use in systemic advocacy and in lived experience advocacy and in practice networks around supporting people with intellectual disability is this idea of constructed intellectual disability, which is kind of similar to the previous slide's content, but essentially it's this idea that if a person has not been supported to experience a diverse range of areas of life when they're younger, due to perhaps a risk avoidance, or perhaps there's just been a lot of time needed to be spent on various other supports. It might be that a young person with intellectual disability has not had a chance to play a range of sports or experience a range of different forms of media, or has not had opportunities to build natural friendships and to go and hang down at the local shopping centre with mates or that kind of thing, or anything in between. And so it may mean that when they do start taking risks, or they're supported to take a few risks or do things that are a bit more than what they may have done in the past, maybe they will experience some failure or something like that, or there might be an accident, and that may be rather viewed as if it's proof of that person's vulnerability and the fact that they need to be wrapped in cotton wool. So one of the things we often say is that people with intellectual disability are most vulnerable to being labelled as vulnerable, and that therefore preventing them from trying new things. And it's concerning. Sometimes we'll find that people we work with will, I've had colleagues in the past that have, just been, I guess, case managing, if you like, a person and their supports, and a support worker or a volunteer has suggested going for a bike ride with the person, with the participant with disability, and the coordinator or the case manager has said, oh no, that's far too risky to go on a bike ride. They could be injured, to have an intellectual disability. And so we've sort of had to jump in and say, well, how did that one get through the keeper? And had to say, no, our role is to support people to take risks and to mitigate risk, not avoid it. And then I guess there's also these low assumptions, which I guess I've probably spent a bit of time outlining already implicitly, but essentially, if there haven't been attempts to use supported decision-making or different forms of communication support, and therefore a person has maybe not yet had a chance to find what helps them learn new information or new skills, then it may be prematurely decided by people around them that they don't have the capacity to build those particular skills. And then, of course, in adulthood, a person with intellectual and cognitive disability may have taken on that sense of otherness and identified with being the other, and may be used to being infantilized. And we also have plenty of horrific stats around marginalization and loneliness. For example, the rate of severe psychological distress and suicidal ideation for LGBTQ people with intellectual disability is 90%. Just give an example. And there are plenty of reports that you'll find if you dig around, Australian reports from over the last 10 to 20 years, looking at similarly alarming rates of loneliness and isolation. So another concept that we use is this concept of citizenship. So that's not your passport or your nationality. Citizenship is a term that's used in intellectual disability advocacy and practice circles to refer to this combination of your agency, your self-determination, your sense of identity and personhood, and then also your engagement with a range of what we might consider to be adult domains of life, or the domains of life that many of us usually get to fully experience when we are seen as being trusted with self-determination and capacity as grown-ups, right? And so the examples that are often used are on the screen here, but there are other areas, like, for example, financial management or buying property, but the ones on the screen here are the most common domains, are usually associated with citizenship domains. So sexuality, relationships, parenting, learning about politics, voting, career, spirituality and faith leadership, risky recreation, and learning skilled work or building a profession in a skilled discipline. And many of us, I guess, are sort of entrusted with the ability to do these things, usually when we turn 18 or maybe a bit before or a bit after, without necessarily someone popping out of the woodwork suddenly and saying, have you done a test to do this? Obviously, we need a driver's license, but when you're 18, you can vote. there are plenty of times that you might know people in your life, whose voting patterns are related to basically their parents' voting patterns or their local community's majority voting pattern. And often those folks may not be quizzed on whether they actually understand the policies that they're voting for, but they're not necessarily questioned. We can choose to be parents, we can choose not to be parents. Sometimes people would like to be a parent and things have happened that have not made that possible or easy for them. But that agency to seek some of the supports that might be available, like IVF, for example, are still available. And I could go through all of these in a lot of detail, but I won't. What I'll do is move to this next slide, which is a representation of a vast array of citations and papers. And in essence, what this diagram shows is the ways that people with intellectual and cognitive disability, due to that assumed vulnerability, glass ceilings, assumptions about not having capacity, risk avoidance, a fear, perhaps a genuine fear of a person being exploited, that kind of thing. But for various reasons, that this sense of capacity is sort of downgraded, or a person may be viewed as being only able to experience a limited form or a guarded or suppressed experience of one of these domains, or maybe needing to be subject to some kind of assessment first. And then in other cases, such as in the green bar there, situations where there's a systemically limited approach. So for example, people who are viewed as not having the capacity to understand the nature or significance of voting may be removed from the electoral roll. There is a process there. I won't go into the process now, but that is pretty common. In fact, there may even be a lack of opportunities systemically to ever even learn about politics in accessible formats or accessible language, let alone seek to be enrolled to vote. There are many scenarios I've seen over the years, unfortunately, where a family has had a strong gatekeeping role, or there has been guardianship there, and things have happened that have led to a person experiencing forced sterilization so that they won't, and it's usually women, of course, so that they won't be able to have children. And also suppression practices targeted at LGBTQ people with intellectual disability, where there's a prevention often from getting access to information about what it means to be LGBTQ, just to even know that that is the label that would probably match your experience of your sexuality. And then, of course, also there's sort of limited experiences of career and work, where many people with intellectual disability still find themselves in enterprises or percentage wage paid jobs, rather than being supported to build over time a sense of career, rather than just, a chain of jobs. And so as a result of all these different dynamics we've talked about, we have some pretty horrific outcomes that became apparent during the Royal Commission. So people with intellectual and cognitive disability are 10 times more likely to experience restrictive practices than people without disability. The Commission also found that supported decision-making is underused and in practice often defaults to substitute decision-making. People with intellectual disability are vastly overrepresented in the prison system, and there are estimates of anywhere between 8 and 15 times the rate of the general population. For students with intellectual disability, the education system was described as segregating and excluding. It's estimated that over 15,000 Australian people with intellectual disability live in group homes or similar settings, and we know that there's often a range of pressures and needs and funding limitations or pressures from family in relation to risk that lead to people with intellectual disability often not having a choice or at least a sense of what the other options might be for how they might live. And group homes were in fact identified as one of the most dangerous settings for people with intellectual disability, more so than other family homes, mainstream schools or shopping centres. Employment rates for people with intellectual disability remain extremely low, so only 30% of people with intellectual disability over the age of 25, only 30% were employed, and the majority of this number were in Australian disability enterprises, which is essentially a form of segregated employment. There are some organisations in that subsector that are doing a lot of work to pivot and change, particularly over the coming 10 years as government policy shifts away from this approach to employment, but still only 13% were in open employment earning full wages. And there are some other stats there that I won't go into. And traditionally, what services have looked like in the disability sector, as I go through this quick lightning tour of what the status quo has been, I'm almost through, I promise. I guess the model on the left is the traditional model that many of us would be aware of, where you have some sort of day service or, a group home as well, but essentially a service run by an organisation, by a service provider, where people with intellectual disability are in together in a congregate sort of model, and there might be limited opportunities to experience genuine connection in the broader community. Obviously, the NDIS has seen a massive shift towards personalised or community-based experiences, but there is still a lot of sort of disability-specific programming out there. Inclusion Melbourne is not entirely opposed to disability-specific opportunities, but there's a lot of caveats we put around that. So all abilities sports competitions, for example, can be great when they're connected to a flow into mainstream opportunities, when there's opportunities to connect with the broader community, when there's opportunities to build skills and relationships, and there's also an awareness of the other options that are possible. In the same way, self-advocacy groups are an amazing way for people with intellectual disability to learn and be empowered together and build solidarity. But essentially, you had centralised planning, group-based delivery, and that limited connection to community. Whereas the model of personalised, community-based service coordination, which is becoming more common, which is fabulous, is where you have, a service provider or maybe some other organisation that is a broker of supports, but will hopefully be working to connect people with intellectual and cognitive disability to opportunities for open employment and skill building, and to mainstream clubs and community groups, with a very strong focus on social connection and helping create that bridging in relationship to build natural relationships. As I mentioned earlier, and this is, I guess, the last point that's important to share before bringing this all together, and to say to give you a sense of why I'm sharing all this information with you, is this this pressure that is a downward pressure on opportunities for people with intellectual disability, to experience freedom from poverty. Many people with intellectual and cognitive disability that we work with often are connected in with some of the many government-funded employment programs or contracted programs where they're matched with a job coach or an employment consultant to support them to find work. But we find that without really great skills in supported decision-making and person-centered planning, many of those disability employment providers or support providers really struggle to actually unlock the skills and unlock mainstream open opportunities for employment, let alone do that work of mediating the reasonable adjustments that employers should make for workers with intellectual disability, and also making sure the right supports are present in the workplace. And so what this means is that many people with intellectual and cognitive disability who we work with don't necessarily have an understanding deeply of what work is and what the purpose of work is and what it's for, what it means to have a vocational journey, what it means to, go on an experience or a capacity building journey of learning about the different kinds of work that they could be doing. Or maybe they have experiences in workplaces where they're viewed as not being capable, but because an inappropriate level or type of support was provided in the workplace. Or perhaps there was a lack of cultural and psychological safety in the workplace for people with intellectual and cognitive disability. We also then see that often families and the loved ones of people with disability don't feel confident that it's possible to have a journey or a pathway into open employment. And we also might see that the impacts of not having social connections, not having friends, being sidelined, being infantilized and treated like a child, that it can often lead to mental health issues that don't get the right attention. And some of these can often come out when somebody is in a workplace, and again, be viewed as something related to the disability rather than the person's needs. And we also see that a person might have funding in the NDIS plan for good support in the workplace, but the organisations around the person don't know how to coordinate and leverage that. So what this means for the relationship then between volunteering and people with intellectual and cognitive disability is that there is volunteering, there are volunteers who work with people with intellectual disability, and there are many people with intellectual disability doing volunteer work. But we often find that a lot of it is a little bit mixed up and the wrong way round, or in the wrong order, or with priorities that are a little bit upside down. So we'll often find that a person with intellectual disability will be volunteering. They'll have a volunteer role of some kind. But as we dig a little deeper, we see that they are in poverty, they're on a pension, they're actually capable of paid work, but they've not been supported to do really good work planning and consider their options. And the volunteer opportunity they're in has a sense of safety and stability about it, and there's not a lot of pressure on the often a business that is benefiting from the volunteers' work. And no one's come in and said, that's unpaid work. And, there's some ethical problems here. And so what we find is actually what's needed is a sense of mapping the opportunities and the potential. And I understand there'll be a lot of, but what about, and but what about to a lot of the things that I'm saying here. But I guess what we're talking about is looking at all these things together for each person. We also then find that there are people with intellectual and cognitive disability doing a volunteer role, but it's talked about sort of in the next breath as work experience. And we'll see that there are not necessarily clear learning objectives or mutual benefit. And we'll often see people with intellectual disability doing a volunteer role in the disability organisation that provides supports to them. At the very least, we would say, well, if the person does want to do a volunteer role, or we feel that the person and people around them have decided they want to build some skills through volunteering, then at the very least could be in an area that we know is connected to their interests, their values, to a cause they're connected with, or in a natural community setting that will, where they'll be doing volunteer work alongside other volunteers that hasn't slipped into essentially unpaid labour, and where there's an opportunity to build natural relationships as well. And then we talk about this idea of the right of people with intellectual disability to experience the benefits and the richness of volunteering that many of the rest of the general population experience. And we totally agree with the right of people with intellectual and cognitive disability to experience this, but we struggle with that as being seen as a priority, or even being seen as evidence that the person is included in their local community when they don't have maybe other valued roles and they don't have support to have meaningful relationships in their life, and they haven't had a chance to look at the other options or opportunities that could be available to them, particularly if they're living in an experience of poverty. And so you can see there in the column on the right that we'd see volunteering as one of many other areas of full citizenship that we would advocate for people with intellectual disability to experience. And just about to round up my section. So I guess, as I said earlier, that people with intellectual and cognitive disability often are more likely to experience a very high level of isolation. And so actually what we would advocate for is social connectors. And this is where we often see the most powerful volunteer roles that people in the general population who don't have an experience of intellectual disability, or maybe some who do, that a role that they could play is a social connector role, such as a Leisure Buddies, which is one of the programs that we run, or other volunteer roles that are all about building those natural connections. And then lastly, we often see that there are, we know about many disability support providers who have a team of volunteers, and sometimes those volunteers are doing work that looks a little bit suspiciously similar to unpaid direct support worker roles. And there are some situations where maybe, the arrangement there is legitimate and fine and ethical, and that's okay. But often what we see is that, what I see, I should own this, I guess, is that some of those volunteer roles could be slightly redirected so that they're able to provide mentoring, perhaps provide vocational skill building support to people with intellectual and cognitive disability. And maybe instead of a focus on volunteers in a segregated disability-specific sports program, actually encouraging volunteering or volunteer roles to be developed in local mainstream sport and recreation clubs. If people want to volunteer in that area, to volunteer to support inclusion in a mainstream setting. So I know I've shared a lot of paradigm shifting, ideologically charged content with you all. But yeah, I really appreciate this opportunity to run through this framework so quickly. And I'll hand it back to Ruth.
Sorry, thank you, Nathan. That was great. It's always fantastic to listen to Nathan, and I always glean something new every time. So I'm just, sorry, obviously challenged with these slides. We'll get there. Hang on. Oh, here we are. I think I've got the slide. Okay, so I'm just going to spend the next few slides just going back to inclusion in volunteering, some of the nuts and bolts stuff, but also I'm going to talk about some of my experience over the years. I've worked in not-for-profits and local governments, and yeah, so just drawing on some of my learnings. So this first slide here is from the CVA guide. So that's the Volunteer Administration Professional Practice, page 147, if you've got that. And what it states in terms of inclusion is that volunteering is seen as one of the best tools to promote diversity and inclusion in society. And I actually believe that's why many of us work in the volunteering sector, and keeps us, and well, it keeps me staying here as one of the key reasons why I love it. But to become an inclusive, to have an inclusive volunteer program, or here they've put inclusive organisation, they've looked at these following steps. So one is to have a diverse volunteer workforce, and number two is to have the policies and programs to promote diversity. And this is where the national standards for involving volunteers becomes very important, because we're not leaving diversity and inclusion. We're actually not leaving it to chance. We really want to put it into the policies. We want to maybe even do like a mini audit against some of those inclusion standards and see how we're going. But the step from 2 to 3, that's the tricky one, isn't it? It's becoming an inclusive organisation. So that's utilising the workforce's diversity and promoting an inclusive society. So that is where I'm going to kind of be looking at today, that space between 2 and 3. And one thing that I will say is that with my team, maybe about 6 months ago, I did a barometer check, and I said, so across the volunteer engagement cycle, how inclusive are we? And I wasn't quite expecting the response I got. It was a little visceral. It was a little negative. And so, and that's fine. I think that's good, because they felt they could actually say that. And be honest. But it goes to show that there's always work to do. And, that they even provided, some solutions and quick fixes that we could do to maybe incorporate some more inclusive practices in our volunteering programs. So there's that was a bit of a shock, but it's also good. And you know, if that's something that you want to do as well, just prepare yourselves for what people might say. So I did want to have a look at a few key terms, and you saw the slide before. There was a bit of a separation between diversity and inclusion. Just because you have a diverse workforce or volunteer workforce doesn't mean you have inclusive practices. But diversity is a great place to start, and it really addresses the who and difference. So diversity is quantitative and it focuses on representation. It acknowledges and values differences in society or between individuals. And diversity describes the variety of human differences that exist within a team, a workplace. Oh, sorry. Thank you. Okay, I think thank you. Um, that exist within a team, workplace, or community. And look, these are some of the areas where, you know, we can have diversity in our volunteer programs: race and ethnicity, gender and gender identity, etc., etc. And I'll just draw your attention to how I have expressed physical and intellectual disabilities. Mobility and cognition is one way that you can word that, which is something for your policy documents if you want a different way to articulate that. So there are some criticisms of diversity in that if there is not a commitment to dismantle systemic inequalities, diversity can reinforce existing power structures. So now just moving to the next slide, which is one of the key terms around inclusion. Yeah, I'll get there, Sarah, with the slides. Sorry about that, folks. So inclusion is the how. And this is the key thing. It's the how. And this is where, as volunteer managers, we can really have some influence. And it's the action that addresses equality. So inclusion is qualitative and it focuses on the human experience, which is what we do. It measures whether people feel like they belong, have a voice, and are empowered to participate fully, influence decisions without fear of discrimination. And that's why volunteering was seen as one of the key areas for inclusion. So a truly inclusive environment in your volunteer program organisation means equal access. Everyone has access to the same tools, resources, and opportunities to succeed. And I just want to frame this. I'm coming from a very practical point of view here as well. Psychological safety. This is a big one. People feel safe bringing their authentic selves without judgment. And active participation. Diverse perspectives are not just present, but are actually heard and integrated into decision making. So we can sometimes just wrap this up by saying that while diversity is a factual representation of your workforce or community, inclusion is the conscious action that makes it thrive. And that's the space that we work within. And just within, you know, I think one thing that I would like to say about bringing our authentic selves, I really like that part, because the last thing we want to do is recruit ourselves. You know, we want those differences to come into play. We don't ever want to kind of like, we want to accept those differences. And as volunteer managers, when we're recruiting, we need to be very conscious of the diversity and not recruiting ourselves. The last thing I need on the volunteer programs that we have are clones of Ruth there. And that sort of also comes into the privilege that we have as well, working in this space. So just moving on, just some other core concepts of inclusion that I would like to touch on. And I think I've already spoken about this, but volunteer inclusion, volunteer management, it is intentional. Okay, we don't leave it to chance. We have to be very active about it. So we actively cultivate environments where diversity is not only acknowledged, but it's valued. And this means understanding and integrating principles of diversity, equity, inclusion into everyday leadership and formal volunteer programs. So yes, there's definitely a focus on diversity and equity. And as I've mentioned, psychological safety is foundational. We want our volunteers and staff working in volunteer programs to feel accepted, to have freedom to ask questions and make errors, to feel that they contribute meaningfully, and that we recognise that people bring different lived experiences. Their perspectives are strengths, even when they're not our own. And we create, again, that space where differences thrive. And now this is these 6 traits of inclusive volunteer managers, which are below. This comes from research and I found this through a training I attended last year through Women's Leadership Victoria. So to be an inclusive volunteer manager or leader in an organisation, these are the traits which which are important. So a commitment to inclusivity, the courage. It does take courage to step out and have a voice. Aware of your bias, curiosity, asking questions, cultural intelligence, and collaboration. So those are the features or traits of leadership where volunteer managers, volunteer programs can create an inclusive environment. And for myself, we all probably have bits and pieces and some of those traits, but we do have our strengths. And I invite you in the chat to put in, 1 or 2 of your strengths in that area. For example, my strength certainly I feel is collaboration, and aware of bias is something I wouldn't say that's my strength. I have to intentionally cultivate that. So please feel free to put in your strengths, your volunteer management strengths there around inclusivity. It would be good to see those. Just moving on. So I'd just like to talk about now some learnings that, and I'm going to I'm just going to pop all these in here. So this is inclusion in practice, some of the learnings which I've gleaned and I've percolated a little bit. And the first one is around our experience surveys, volunteer experience surveys that we might run every year, every 2 years. And it's a great place to ask those questions of volunteers in terms of how effective have our intentions inclusivity been? Have they translated into practice? Because we can't actually measure our intentions. Okay, sure, we can count policy. We've got a sentence in one policy about inclusion. We've done this, we've done that. But to actually measure inclusion, we have to ask people about their experience. And so we can do that in volunteer experience surveys formally. We can also do it informally by having conversations with volunteers. There are probably a number of avenues where we can elicit that experience from people. But I take this a step further. When people read the questions around, which are inclusive questions in our experience surveys, I want them to feel it. I want them to feel, gosh, the team or the organisation, they really want to know my experience. So sometimes wording and crafting those questions is just as important as the answers themselves, because through that experience of filling that in, I want them to feel that they are safe and they can put down what they really feel without any fear. So these are just some thoughts. So recruitment questions could be, do you feel the organisation welcomes volunteers from diverse backgrounds and lived experiences? You could sharpen that up if you wanted to. Culture and belonging. Can you describe a moment when you felt genuinely included or welcomed here? What made you feel that way? Have you ever felt excluded or uncomfortable in your role due to your identity, background, or communication style? And maybe around accessibility and support, do you feel comfortable approaching your supervisor to request accommodations or express needs? So there's a whole, this is just like a tiny little snapshot. There's probably many areas that you could look into, but just keep in mind intentions, very difficult to measure in inclusive intentions. But we can measure experience, and that's really our in. And once we get that data, we can look at that data and go, okay, well, look, we really need to focus here, here, and here, and then get a mandate. And most volunteer managers I know, we're sort of middle managers, so always getting that mandate for inclusivity is very, very important. So just moving on to the next slide. And thank you for those people who have put down their strengths. I do appreciate that. And I'm still on the feedback, just because I feel this is one of the most important areas. Some of the biggest criticisms I've heard from volunteers across the years is, I'm not heard, I'm not listened to, no one listens to me, my voice, it doesn't matter. And I think it's really important to manage expectations. And we know this as managers of people across the volunteer engagement cycle. It's really important that we manage volunteers' expectations. And this is the same when we are seeking feedback. So some few tweaks to our process, we can help alleviate some of those feelings of not being heard. And that's to be very, very clear. And look, in the national standards for involving volunteers, we do ask for feedback. It asks us to ask feedback on, policies and role descriptions, where it suggests that we ask volunteers for their feedback on documents which relate to volunteers, which is great, but it's how we frame that. So often feedback, and these are some definitions here, is saying we're giving you permission to tweak. We're asking for your feedback. And by feedback, we mean if you make some suggestions, we'll probably take those on board if we can and tweak the document. Consultation is slightly different. That's like, we've got a plan, we've got the document, it's pretty much good to go. But what do you think about it? Okay, so consultation is kind of a word I try not to use. I prefer feedback, but I'm very clear on what I mean by the feedback. So I'm managing those expectations. And co-design, this is a really great one if you've ever been in a position to co-design a program. And Nathan has done a lot of co-design, which he mentioned. So we're asking for you to help reshape our program. This is a partnership. And this can be rare in formal volunteering. It's usually community-led, which is great. And sometimes these co-design community-led initiatives eventually turn into formal volunteering. So it's just, I guess it's just being very careful how we seek that feedback, because it's really important for inclusion. And I had an experience once with a member of an advisory committee, a disability advisory committee member, said, I'm here and no one listens. I've got all these ideas. I've communicated them and no one is listening to me. Where is my voice? Isn't that the point? And it kind of is, particularly for that role. So I did ask, would you like me to pass this on? And they did say no. because they were worried that they might lose their role. But I think managing expectations can alleviate and some of the tension that can arise. So these are some other learnings, and you might have heard these yourselves. And this is around, I'll just use number one, trying to speak on behalf of volunteers. So sometimes I have, staff members saying, I know that wouldn't work for our volunteers. They are older and wouldn't understand about logging into a system. And also sometimes you get volunteers speaking on behalf of other volunteers. And so it's using those those traits that we have as inclusive leaders around being aware of bias, maybe curiosity and courage to tackle those sort of comments that come up. And now I quite often just say, I don't say this directly. I might couch it, but I might just say, look, where is the evidence for that? That's thanks for sharing, but I'm interested in the evidence. And look, using the word "our volunteers" can be very problematic because it confers ownership. And at the heart of volunteerism, community members are giving their time willingly and for the common good. And yes, they're formal volunteers and they're engaged by the organisation, but at the heart, they are still community volunteers. So I know there's a bit of tension there, but I do try to find other ways to, instead of saying our volunteers, so you could say leisure buddy volunteers, or, different ways instead of using the word our. And I know when it comes to National Volunteer Week and our annual reports, our gets used a lot. And look, it's not always about recruiting for the role, but for tasks within the role. I know for myself, it's very difficult to get a new volunteer role up and going, but best practice is matching someone to a task or part of a task, particularly if we want to drive some inclusive practices there. So are we open to doing that? And inclusion can happen between the volunteer tasks. It's really listening, taking time to hear someone and making them feel part of the team, actually really being heard. Using those active listening skills can make some of the biggest differences to a volunteer's experience. And volunteers generally mirror the community in which they work. So if you live in a highly diverse a local government area, for example, your volunteer team is going to generally be quite diverse. If you're living in quite an Anglo-Saxon area, then you will have to work a bit harder to drive that diversity and really target your recruitment practices to drive that diversity. And look, just finally, I'm just going to talk about working with support workers. So if you're a volunteer manager and you do have a volunteer that comes in who does have an intellectual disability and they have a support worker that's coming in to support their volunteer work, how do we manage that relationship? And what I have found is that there's a difference between very experienced support workers and new support workers sometimes. Experienced support workers will know how to manage that and you can talk to them about it. But the best thing that you can do is to direct your conversations to the person with the intellectual disability, and an experienced support worker will step back. Sometimes a new support worker might try and step in and talk or try and translate for you what the person's trying to say. And if you don't understand, it's okay to say, I don't understand. So I think I might just leave it there, Sarah, for now. Obviously, this is a big topic. There's lots of places we could go into, but thanks for sticking around and thanks for listening. It's been a real pleasure, and I'll leave it there. Back to you, Sarah. Thank you.
Thank you, Ruth, and thank you, Nathan. I know, I always get so much when listening to the both of you, and I can tell by the comments in the chat that there's been a lot of engagement with today's material, both in terms of those really those frameworks and assumptions that we don't often interrogate, but also some of those real practical learnings and observations and ways that we can hone and, you know, consider our practice. Now, given the time and given that we're already a little over time, we won't sort of take questions, but please don't hesitate to get in touch via the National Strategy email address with any questions that you have for today, and I'd be very happy to follow up with Nathan and Ruth. And so thank you all again for your time. Thank you, Nathan and Ruth, particularly for sharing your wisdom, and I mean that, wisdom. And I hope everyone has a fantastic afternoon. See you later.